Drama therapy is a combination of both drama and psychotherapy. A definition of drama therapy is that it's the intentional use of theater processes to promote personal integration and healing. So instead of a client just talking about their experiences, they're actually getting to embody them. Therefore, it's very proactive. A drama therapist uses props and lighting to recreate a client's environment, and therefore the client's getting to act out the possibility of a healthier and happier scenario. There's both dramatic and therapeutic competencies involved in drama therapy. Some of the more dramatic ones would be role-playing, improv, puppet work, storytelling, being able to move creatively, creative use of the voice. And then some of the more therapeutic ones would be listening, supporting, analyzing, and being able to interpret their client's behavior and motivations. So representing oneself through drama is really important to all human development. A child's cognition and affect develop through drama and play. So using drama therapy, drama therapists are able to look at a child's play and see kind of what's going on in their heads.
Drama therapy had its start in experimental theater, which began in the 1960s and 70s. And experimental theater is when drama and psychology were first beginning to intertwine. Then in the 1970s, people started incorporating drama therapy in institutional programs, but it really had its start when the National Association for Drama was established in 1979. The nature for drama therapy is not really clear yet. It's continuing to evolve, so drama therapists have little by little been creating their own models. There are many different outlets for drama therapy. One of these is dramatology. Much of the ideas for this concept come from wanting to branch out from the norms of psychotherapy and create a more lively experience for the clients. A big section of dramatology deals with dreams. Freud considered dreams to be like the client's own personal theater. The way we dream is almost like a drama in itself, which is why the exercises work so well. They can help to determine a problem, especially involving someone who may have been traumatized and is dreaming about it. It creates a more relaxed and entertaining environment instead of sitting on a couch having someone interrogate you about a problem you are trying to repress.
So like Lindsay said, there are many different approaches to drama therapy, but there is a 5-phase integrated model that most drama therapists tend to follow. So it shows the gradual progression from playful improvisational work to more in-depth psychodramatic work. And it creates this creative drama mode where there is a fictional metaphorical realm for clients to play in, which is supposed to have a liberating effect and allow them to have revelations about themselves. So in phase 1, there is a building of trust between the participants and the patient. And it's mostly spontaneous interactive improv games, so it's just to set the metaphorical realm up. And eventually this evolves to phase 2, which is more sustained dramatic scenes with developed roles and characters. These 2 phases, the first 2 phases, are supposed to give the clients that freedom to express themselves and to behave in ways they normally wouldn't. The therapist doesn't do anything but keep the spontaneity going, so there's no analyzing out loud or anything of that nature. These phases are most popular with children and the developmentally disabled, so because there's so much play for children and they're much more comfortable with that. Phase 3 involves role play and enactments of current personal issues in the client's lives. So if an event of the day upset them or anything, they can reenact that. There's also reenactments of relationships that they might have trouble with or that they might enjoy, just to kind of explore what's going on but in that situation. Phase 4 is just a continuation of phase 3, except they are what they call culminating enactments, which is just discussing more personal, deeper issues and recurring themes in the client's lives that they have difficulty with. So by phase 4, the clients are able to examine themselves more closely and able to understand why they may act a certain way. These 2 phases can be more therapeutic because they are more emotional in their nature than the first 2. So phase 5 is basically just a wrap up and a closure and a review of that session's journey, and it's just a discussion between the therapist and either the individual or the group members, and just how they are feeling at the end of everything. And this can all happen, all of these phases can happen in either one session or over a longer period of time.
So now we're going to demonstrate a game that would be included in a typical drama therapy session. Drama therapy heavily relies on improvisation and storytelling, so Maddie's going to act as the therapist and Brooke is going to act as the child who's in therapy.
All right, Marcia, so we're going to start off by telling a story. I'm going to begin it and you can continue it, and we'll trade turns telling the story, okay?
Okay.
All right. Once upon a time, there was a small squirrel.
This squirrel was fluffy and brown.
Very fluffy and brown. It liked to run through the leaves.
Yes, because it was so small and fast, so it just zoom.
It would zoom towards the nuts, but there were some other squirrels who were also trying to get some nuts.
They were mean squirrels. They were bigger than the little squirrel, than the small squirrel. But the small squirrel had magic powers.
Small squirrel had magic powers, and it could turn invisible.
Yeah. So the big squirrel couldn't see him, and so he could get all the nuts without the big squirrel punching him in the face.
So in that example, the child Marcia brought up the squirrel being bullied. If this theme continued to be brought up in the stories, the therapist would be clued into the fact that the child is probably experiencing issues with bullying. So this is part of the creative drama mode that's established in phase 1 of the integrated model.
Yeah. So the big squirrel couldn't see him, and so he could get all the nuts without the big squirrel punching him in the
So in that example, the child...
Okay, I go now. Okay. Like Lindsay said, there are many different approaches to drama therapy, but there